same when you check your type?
Yes.
If you previously had asthma,
Yes.
oh my god, you need asthma, you need inhaler?
Yes. I have. Yes, it is look at inhaler.
Okay, later I will give you inhaler. No, first I will give you Prevotus.
Yes.
Why, Mr. Sari?
My chest pain feel thick and way too cold.
What happened? Are you okay?
Yeah.
Do you asthma?
Yes. I have yes, I have asthma and chest pain, especially cold and again inhaler. Can't help.
Okay, I will give you check respiratory and push.
Okay.
I will give you two masks and you use nebulizer about 10 minutes.
Okay, nurse.
Good morning. Hello, I am Susan. I will be looking after you today. Mrs. Rodo, do you mind if I call you by your first name?
No, hey Sultan, nice to meet you. Please call me Nafis.
Oh, thanks. I always like to ask first, Mrs. Nafis. I wanted to ask to you about your operation tomorrow.
Oh, is everything alright? There nothing wrong, is that?
No, no at all. Everything's fine. I just bring this chair up so I can sit with you. There's no problem. I just want go through what will happen. What will happen when you come back after the operation? People always feel better if they know to expect.
Oh yes, you're right. I am so nervous about the operation. I haven't been in hospital since I was a kid. When I broke my leg, things have probably changed since then.
Oh well, hospital have to change it a bit, but don't worry. I will try go it alone so you have an opportunity to ask as many questions as you like.
Thanks. I feel seriously worried. I am not normally like this.
Mrs. Nafis, it is a quite normal to feel a bit apprehensive. I will try and go for everything so you are prepared what will happen after the operations. I see you have a the leaflet keyhole surgery.
Yes. I was text in it max. So the only things so the a big scar. So the operation won't leave a big scar. I will just a couple of small holes in my tummy.
That's right. The keyhole surgery is also called minimally invasive surgery because it is performed with the use of laparoscope. Using a small incisions or surgical cuts, you will probably have three or four puncture sites. There are just small holes made near your navel, so you will have a dressing to covering the holes surgery.
Oh,
During the operations, the surgeon uses a laparoscope, which is pass through the hole is visualize your gallbladder. The infected gallbladder is removed through the largest of puncture sites, and you will have a mini drains. It is a small plastic container attached some tubes to which takes any excess blood from your wound.
oh, there won't be lost me a blood will there. I will take the sick of blood.
No, not much, but I can make it not for the rest for the staff to cover your drain, so you don't have see of it.
Will I drip in my arm?
Yes, you will come back with an IV and some running feeds, just until you can eat and drink again.
Yes. I have to eat straight away.
Yes, you will have had to down your throat for the anesthetic. So we need to know your swallowing reflex is working after the tubes have been removed.
Oh, is that why they do that? I never knew. It makes sense to go slowly.
You have any tube? It is indwelling catheters, and to take out your urine. So no, I can go through to the rest for your information. Thank you of your cooperation, Mrs. Nafis.
Yes.
I promise to go first.
Assalamualaikum. Hello. Excuse me. Let me introduce myself. My name is Sufa, and I'm here. Can you tell me your full name, please?
Yes, of course.
Okay. What is your date of birth and how old are you?
Teacher of February 1996, 20 years old.
Okay. Can you tell me why you were here today?
Well, I got it.
Okay. Is there any family here accompanying you?
Yes, there is my sister. It's easy to me two people when I'm third year.
Okay, well, if there is a family here, I will ask you some question and check out to complete nursing documentation.
Okay.
Okay, what is your accompanying now?
Yes, I'm student of university as well.
Okay, that's good. Do you remember why you were taken to the hospital before?
I was following the lecture. Suddenly I feel headache, and after then I didn't remember anything.
Okay, do you have frequent headaches?
Yes, I do. I often headache, easy for sleeping, and
Okay, are you smoker?
yes, when I was junior at school.
Okay, do you like consume alcohol?
I don't have, I never consume.
Okay, what food and beverage did you consume?
I like sweet food, sauce fruit, and also egg. Attempt not lower to chapter, but I can if I habit.
Oh, I'm worried with your blood sugar. Let me check your blood sugar first. Okay. Which one is this? Oh, I'm sorry. Your blood sugar is 220 milligram per dl. It has exceeded normal limit. Normally less than 150 milligram per dl. Okay. Is there previous history of diabetes mellitus?
Yes, there is. The doctor diagnosis about diabetes mellitus type 2. At the time, I was with I weighed 220 pounds and my weight was 178.
Okay, you're way into overweight level because your BMI is 31.6. Categorical ideal BMI is 18.5 until 24.9.
Yes. What's diabetes mellitus type 2?
Okay, I will explain to you. Diabetes mellitus divided into three: diabetes type 1, type 2, and diabetes mellitus gestational. And here now I just explain to you what is diabetes mellitus type 2 that you suffering. Okay, diabetes mellitus type 2 is caused decline the ability of insulin that to stimulate glucose uptake by peripheral tissue and inhibit production of glucose by the liver. Risk factor that can cause diabetes mellitus type 2 is obesity, age, and family history.
So, what's second symptom?
That is headache, fatigue, and feel sleepy, blurred view, and often felt thirsty and hungry. Is there family history that suffer disease like you, Mrs. C?
Yes, there is my father, but he was set away on 27 July 2010. Cause diabetes. I also was.
Oh, I'm sorry to hear that, Mrs. C. Mrs. C, a result of the assessment, you are very risky suffering diabetes mellitus, such as unhealthy lifestyle, previous illness, hereditary disease history, and your blood sugar exceeded normal level. For the next, I will consult with medical therapist to handle illness and give pharmacological therapy and consult with the nutrition to about your diet that according for you.
Okay, thank you because
Okay, my advice for you is you should do exercise regularly to get ideal weight and reduce food that contain a lot of sugar, and the last is avoid injury because it can make long healing.
okay, thank you very much
Okay.
for your advice.
Okay, you are welcome. And now I will back to the nurse station. If you need some help, you can press red button beside your bed, and I'll back to your room. Okay?
Thank you.
Okay, you are welcome.
your name, please?
Good morning. Yes, I can. My name is Wisnu Pradana.
Oh, Mr. Wisnu, my name is Sitinya Chandra Hasuti. You can call me Nia. What's your date of birth?
I am 28 March 1993.
Okay, 28 March 1993.
Yes.
Are you occupation?
Yes, I'm occupation.
What's your complaint?
I want to complain about my lifestyle.
What's wrong?
I haven't been looking after healthy lately. I have put on a bit of weight.
How much your weight before and after sick?
Before I'm sick, my weight is 70 kilograms, and after I'm sick, my weight is 50 kilograms.
Oh, okay. I did like to talk to you today about lifestyle and nutrition. You will have to make some minor changes if you are going to avoid nasty complication. How many meals a day do you eat?
It depends. Sometimes I skip meals. I just cannot be bothered.
Okay, I know it must be difficult for you, but it's important that you eat small regular shift. You need to reduce your intake for saturated fat. Try to make sure you include carbohydrate in each meal.
I know my doctor is always about that too. I know what the next question is.
Okay, it's about weight control. You really should keep a close eye on your weight. How often do you exercise?
Not enough this day. I just walk along the beach with my wife.
Okay. You told me last time you stopped. Could you try to include some physical activity in your daily routine?
Yes, I suppose so.
It will be good idea to get back to walking along the beach again.
Alright. I'll make an effort to do that. Any other change?
Yes, I just got a couple more. What's your alcohol intake like?
Yes, I'm alcoholic.
How many drinks do you have per week?
I used to have a couple beers in the evening. I have been having a few more this day.
Well, look, alcohol in moderation isn't normally a problem. It can be affect your insulin dose.
Yes, I know. Otherwise, it creeps up on you, doesn't it?
Yes, it does. Last question.
Yes.
It's an important. How many cigarettes are you smoking at the moment?
2 packs a day.
2 packs a day.
Yes.
Good for you. It's hard, but it's important to stop smoking if you want to avoid a circulation problem.
I certainly don't want anything like that.
Okay, it's quite hard to quit on your own. You might like to speak to your doctor about some nicotine patches.
Thanks, I'll keep it in mind.
Okay, you are welcome, Mr. Wisnu. See you next time.
See you, nurse.
Assalamualaikum.
Waalaikumsalam.
Assalamualaikum. Good morning, Mr. Tommy. You're back on the road now from recovery. Can you hear me? Alright. I'll just get a quick handover and then I'll have make you a bit more comfortable. Okay?
Okay.
That's right. Okay, Mr. Tommy. I'll just get the information about the operation report from my friend that you're coming after RTA this morning.
Yes.
Alright. Mr. Tommy, you're back. You're back in the ward now, and your head splenectomy today at 11:50 a.m. And then your operation was uneventful and no post-op complication. Mr. Tommy, can you open your eyes for me, please?
Yes.
Alright. Okay, thank you. Mr. Tommy, you're back on the ward now. Do you know where you are now?
I'm in hospital.
That's right, Mr. Tommy. You're back on the work now, and your ops are stable. Your respiration rate is 20, and then your pulse is 80, and then your temperature is 37, and then your blood pressure is 120/64, and your oxygen stats is 97%, 3 liters of oxygen.
Yes. Alright.
Okay, Mr. Tommy, I will change your oxygen tube to offer our wall unit. Can you breathe normally for me, please?
Yeah.
Okay, thank you, Mr. Tommy. Alright. Mr. Tommy, I'll just transfer the bag to our IV stand now, okay? Okay. Okay. Right. Mr. Tommy, can I look at your dress now?
Yes. Yes.
Okay. Excuse me, Mr. Tommy. Okay. It's pattern. Alright. Okay. It's to be removed when less than 20 miles a day. Mr. Tommy, can I check the wound now?
Okay.
Right, Mr. Tommy, excuse me. I will check. Okay.
Oh.
Alright. Yes.
Be careful.
I'm sorry. Yes. Alright. Okay. Mr. Tommy, there is clips. It will cover with clips, and there are 6 clips. Okay. And it will be covered with non-adhesive dressing, and will be checked tomorrow.
Thanks, nurse.
Okay, Mr. Tommy, I'll just take the blanket off for a minute, okay? I'm sorry, Mr. Tommy. Are you feeling warm enough now, Mr. Tommy?
No. Yes. I'm not just sleepy.
Alright, Mr. Tommy, for analgesia, you give petidine, and for oral analgesia at 1:30 p.m. Okay?
Yes. Thank you, nurse.
Okay, Mr. Tommy, I'll just put your notebooks, and I will be come back and take your ops now. Get well soon, Mr. Tommy.
Yes. Thank you, nurse.
You're welcome.
All in the soul of us, on the river of all the dawn, gathered under the India is the digital India, very little emphasis India, the double-headed leader India. Oh, I am the close word of name, and you will probably say the same. When parts of all the faces, how several is the same. Oh, no. Send your code, all the girls, all the things, and the fantasy. BMI, start. Looking at the past, let's do the Messenger and peace and love on the back of come from Asia. India. India. Burying each other in this is India. The double head is leader India. Oh, I don't need those words to me. And the presence of the sea. And the world of the days. The production. Oh, let's run the song. Transport to better, but then you know it's everything in ya. It's the code in ya. Buried in the message in ya. The double head is leader in ya. Oh, I don't need those settlements. And just this way to name. There's always made for saying. Yeah. It's okay. Oh, it's okay. No. Thank you.
Assalamualaikum.
Waalaikumsalam, nurse.
It is Mrs. Savita, isn't it?
Yes, that's right.
My name is Tia. I am looking after you today.
Okay, alright.
How long do you feel the asthma?
1 years ago.
When your asthma relapse, how do you feel?
When I am so tired and I feel pain in my chest.
Okay, I will check your chest first.
Okay.
Your chest sound is reading. After that, I will check your blood pressure and write your respiration rate. Okay, I will check your respiration. Your respiration rate. Your blood pressure 1000/70 and your respiration rate 35.
Okay.
Now I will give you nebulizer therapy. The procedure is I will wear mask that cover the nose and your mouth already contain the drug. Okay, I will connected into nebulizer drug. The drug is absorbed. Will be burned into smoke. Your breath through the mouth until the medication run out. I will read to you. Okay. Okay, I will leave to you. If If the drug is up, please press the red button beside your side, and I will take off the plug. Okay, Miss Savita?
Okay, thank you, nurse.
Okay, Miss Savita, the time therapy is over. How do you feel now? Still thickness?
I feel a bit better than before.
Yes, Miss Savita, it's good. Now I will back to the nurse station. If you need something, press the red button. Okay, Savita?
Okay, thank you, nurse.
Okay, you're welcome.
Good morning. Is it Miss Reva, 54 years old, right?
Yes, right.
Okay, I'm Cynthia, the nurse at this hospital, and I'll take your blood glucose and take your some blood for diagnostic test.
Oh, of course. But is that hurt?
Don't worry, just a little hurt. First, I'll ask some questions. I need to know that your family had this disease.
Let me think. I think my grandma had this.
Okay, then what do you feel?
I feel tired recently and had been getting up at night.
Okay, now did you already know that you have diabetes?
Yes, of course.
Okay, alright, I'll take your blood glucose and take your some blood for send it to the laboratory. First, I'll check your blood glucose. Okay. Ah.
How the result?
Wait, your blood glucose is 350, Miss Reva.
Is it normal?
No, it's high. You need to control your meal and reduce the food that contain carbohydrate and eating the food that contain proteins and do exercise.
I will do that, nurse.
Okay, now I'll take your blood for some blood.
Oh, it is hurt.
Okay, wait a minute.
When the results come to me?
The result will be available in the evening, Miss Reva. I must forget you have 4 days such as stress on your bed, okay? And I'll be here at 4, okay?
Okay, thank you, nurse.
You're welcome. Excuse me. I'm here to give you a result, Miss Reva.
Okay, thank you, nurse.
Okay, your albumin is 5, your natrium is 1 and 40, your protein is 8.5 and your hemoglobin is 7. And your blood glucose is 350, Miss Rafa, and it's too high.
Okay, thank you so much, nurse.
Okay, and as you know, if you need help, just press bell on your bed, okay?
Okay.
Okay, thank you. Assalamualaikum.
Salam.
Assalamualaikum. Hello. Good afternoon, Mrs. Umi.
Good afternoon, nurse.
How are you feeling?
I'm better, but still difficult to breathe.
Okay. I should check your condition, yeah.
Sure, nurse.
Okay. Okay. Okay, the next I have to epinephrine injection for you. Okay,
Yes,
you ready?
Yes.
Okay, finish.
How's my condition, nurse?
Okay, your condition fine. The next but I still heart condition, still breathing and when breathing.
Thank you, nurse.
Okay, I have to. I will give. I will becoming 10 minutes ago. Yes.
Yes, thank you.
You're welcome. Hello, how feeling today?
Yes, I am a little bit fine.
Okay, I check your condition.
Yes.
Okay. Okay, I can feel TTV from condition becoming normal. The next still breathing and it has burn breath. Okay. Okay. The next yes, you should manage your activity to recover your condition. Okay.
Why must I be in sit positioners? My
Yes.
phone was sick.
Okay, your position like this because to the visual to breathe. Okay, it strike on your bone. Okay, the or sleep. Okay, like usually your will be more difficult to breathe.
Oh, I see, nurse. Then when I get home, what medication I should take when my asthma come back?
Okay, I will give you the prescription, the kind medication. Okay,
Okay.
you should take like epinephrine, the next Ventolin, etc.
Okay, nurse. Thank you.
Okay, you will come the next time.
Yes, nurse.
Goodbye.
Bye.
Proteins
Okay, maybe the day after tomorrow. Okay. What will we do? Are you okay?
My chest and sharpness.
The bits. Let's to place to model. Sit down. And learning again. Again the words. Some could drink water. I get in the practice. This water you drink. I will message you with her. Okay. This will can help easy breathing. What can you consider? Yes. Are you better? Since when you feel some of breathe suddenly as it is today. So your age, after 15 years. Did you ever been to consult a doctor? Have you noticed last year for this I am not yet to consult again. I think you should to consult a doctor for decrease shortness of breath. Okay, thanks. Yeah, you are welcome.
21.
Assalamualaikum. Good morning, Mr. Yusuf.
Waalaikumsalam. Good morning, nurse.
I'm sorry that you late.
No problem, nurse.
How are you today, Mr. Yusuf?
Much better, thank you. But my chest still feel tight.
Oh, what are you feeling when you get asthma?
I feel suspicious in my chest and little pain.
Chest pain or anything else?
I feel just
Are you allergic to something?
yes, I have allergy to dust.
Okay. Do you know, Mister? Asthma can happen when someone has allergic to or so thyroid.
When I get asthma and I'm so tired.
Okay, no problem. I have something to help your asthma. It's named inhaler. Do you know how to use it?
Yes, please.
Okay. Wait for a minute. I take the inhaler and show you how to use it.
Yes, nurse.
Okay, Mister. It's named inhaler. Use inhaler in mouth. First set the aerosol bottle before use, and then enter the mouth. Then look to the top of head a little bit. Exhale slowly. Exhale the air lung as much as possible through the nose. Then inhale deeply. Press the aerosol. Resist the breath for 10 until 50 seconds. Exhale through the nose. Okay, it's simple. Do you understand?
Yes, I do. It's simple to use.
Okay, good. Next, I will check your vital sign.
Okay, nurse.
Mister, this is thermometer. Please to check your blood pressure.
Okay.
Okay, and this thermometer to check your temperature. And the next, I will check your chest. Wake up, Mister. Breathe in. Breathe out. Again. Okay, Mister, result the exam. Your blood pressure, your blood pressure is 100, 120 over 80. Your pulse 100. Your temperature 37. Your respiration 32, and your breathing super easy.
Okay, Mas. Thank you.
Okay, okay, Mister. I think enough for your fourth exam. Have a good rest.
Yes.
Okay. Assalamualaikum.
Waalaikumsalam.
Good morning, Penny. How are you feeling now? Oh, I can imagine that you've got a lot of brazen cut. Can you tell me where the pain is?
I hit my cheek around my lungs, but when the cut and my gut hurt too.
Okay. Can you tell me about the pain? Is that the same all over or different?
I have got trouble headache. My legs hurt jack when I touch it.
Okay, I see. That will be because you got a broken cheekbone. The pain is referred to your head, so you get a headache.
Okay, that's my sensation.
What about with your chest and your arm?
When it is the charge in pinch the pinch my chest is quite deep and like knife.
Okay. When's the pain's getting worse, Fanny?
It is worse when I touch it.
Okay. Can you rate the pain for me?
What do you mean?
You can rate the pain for me like this. On scale 0 to 10. 0 is when you feel no pain, and 10 is when you feel the worst pain that you can imagine. So, what's pain like now you are at rest?
It is not cheap.
And when you move a bit?
It gets worse and nice.
Alright. I'll get you something for the pain. Now I notice you to order some paracetamol for our leave.
Yes, I don't want it. I ate extra much.
No, Not on its own, they ordered for you because it worked with the opioid painkillers to reduce the number of you need to take. It reduced the number of injection you should have by 20 to 30%. It's important to taking the paracetamol regularly.
I see the difference there.
Is there anything else that relieves your pain?
When the nurse to give me a fetch bike, that's that happened.
Okay, I'll get the painkiller for you and try, and I'll put the position that comfort you, and I'll get more pillows for you, and I'll get the head pack too.
Thanks, I will try to get the rest and tell you how to sleep and when you are when I.
Okay, I'll get the head pack now.
Satu. Satu.
Good morning,
Morning.
Mr. Intan, isn't it?
Yes, that's right.
Okay, Mr. Intan, my name is Meita and I'm nurse here.
Yes.
Can I see your ID bracelet, please? Okay, your registration number is 10265 and your date of birth is 13 December 1966, right?
Yes, that's right.
So, how do you feel today?
Absolutely.
Can I see your one, please? Your one looks worsening, right? And by the way, I have to check your medical history before.
Yes.
You have an experienced chronic venous insufficiency. It occurs when the vein in your leg blood pump blood and pump back to the bottom and start to that the pressure and in the vein increase. So do you wearing hosiery compression? Why? Your it is appropriate recipe to control your udem in your ear.
Oh my god.
But your udem is grow on your leg now. But don't worry, I'll open your bedding and I'll clean up your one. Excuse me. It is not pain because I use natural chloride to clean up your wound, so you'll never feel pain anymore. But before I close the door to keep your privacy, and I'll wash my hand.
Okay.
Excuse me. Okay, I wearing gloves. I wearing gloves to keep you and I from the infection.
Yes, sure.
It just need 5 minutes, I think. So, are you ready?
I'm ready.
Okay. Excuse me. I open your beading first. I use alcohol to release the glue on the plaster. Take it easy. Okay, and I'll clean up your one with natural chloride like this. And I push your skin around your wound to release the pus, and I clean up again. Okay. And then I'll replace your beading because if the liquid is left out of your wound and you ignore it, it will be infection. So I'll change the beading with the new and clean beading. So I just take from the sterilizer, so the beading still clean and sterile to use.
Okay.
And the last. doctor. Once more. Okay, finish. And you must regularly dressing, and you can consume a food with high protein like meat, egg, chicken, and fish. But if you have allergy about it, you can consume soya and bean to healing your wound.
Okay.
And now I'll consult with doctor to give you some medication about your pain.
Okay, thank you.
You're welcome, and if you need me, you can press the button inside your bed.
Yes.
So, I'll back to nurse station. Get well really soon, Mr. Intan, and good morning.
Morning.
Hello, Miss Aini. I'm Rana Divasha. I'll be looking after you today. Have you settled in yet?
Yes, dear. I've met all the ladies in my room. I just have to wait for the operation now, don't I?
Yes, I'm going looking into the operation list when it comes out later today, so I can tell you where you are on the list. I just need to go track some things with you. Is that okay?
Yes, that's fine. I sent Brown my letter from the chapter for you. Here it is.
Thanks, Miss Aini. Right, let me see.
Yes.
The first, I'll take your consent form. Is that your signature?
Yes, dear. I seek the chapter surgery. I come to the hospital. He explained all about the operation to me.
Good. I get you to take your nail polish later today, so the anesthesia will be able to your nail bed.
Huh?
And you will need to shower the antiseptic wash. Here, sachet the wash for you. Just wash all using to the antiseptic wash as you walk with you.
Alright, I'll do that tonic before I go to bed.
Great. I'll get you to take another shower 2 in the morning, and I'll give you another sachet in a week.
Will Sammy be shaved before the operation?
No, I won't. We used to operation area, but the police has changed now.
Huh?
The best practice is that if it does not, it interfere and surgery, and then the area is not safe.
Oh, good. I remember having it done many years ago.
I know what you mean. A lot of people used to complain about it. No, I see you have been on a low residue diet for a few days. I'm going to order you clear fluid for today, and that means you will be on liquid today. And then the nail by moon after midnight. I've got the nail by moon signs here, which I'll put up the little letter, and it just reminded the kitchen staff not to leave your meal.
Oh yes, that means won't be at or anything after midnight, will I?
No, you won't. The reason for this is that when you have on anesthesia, your muscles relax. If you have anything in the stomach, it can up into your throat. and you might inhale it.
Yes, I see. I certainly before the operation.
No, no at all. I'll get you to a special bowl to clean your bowel. I'll get you to a small enema to help you open your bowel. This is so that's when you surgeons operate. This is less for contamination your bowel contains.
It's pretty patient, isn't it?
Yes, it just take a bit of preparation. I'm going to do one last thing.
I won't. I hope won't. I won't hope be happen.
No, it's not anything like that. I'm gonna to get you some anti-embolic stocking. They are very firm stocking. You put them on to support your leg, and you burn them to prevent deep vein thrombosis, DVTs, or clot in your veins.
That's all right then. They won't be too much or better, I'm sure.
Yes, all right. Anything you want us, okay?
No.
Okay, I go to back the nurse station. When you need help, you can press the button in your right side. Understand?
Yes.
Okay, excuse me. Assalamualaikum.
Waalaikumsalam.
Good morning, Miss Rastini.
Good morning.
How are you today?
I feel so pain now and little hurt.
Oh, what happened with you? Can you tell me about the history?
When I work, myself have a rusty nail puncture.
Oh, what are you doing when your soul have a rusty nail puncture?
I clean my wound with the water, use liquid antiseptic, and dress with unflammable fabric.
Oh, that makes for infection because you clean it without antiseptic, and that's feel you pain.
I don't but it.
Okay, don't worry, Mrs. Rasti. I will manage your one.
Okay.
But before it, I will check your vital signs, include blood pressure, respiratory rate, and pulse.
Yes, of course.
Are you have any hypertension, right?
Yes, nurse. I have history hypertension since once ago. And how about the result?
Oh, your blood pressure is 130 over 100, and the pulse 100 times a minute, and your respiratory rate 26 times a minute.
Thank you, nurse.
Okay. The next, I will start manage your one. I will open your bandage to observation your one, and then I will give you alcohol to I will give you alcohol and antiseptic.
Okay.
If you feel pain, you can take a deep breath.
Oh, it's so bad.
Oh, your one seen reddish, dirty, and the area of one seen swollen. Okay. The next, I will manage your one. First, I will give you of alcohol and give the one antiseptic to remodelize the bacteria, and then I will dry the one, but not until really dry. And the next, I will close the one until all the one closes.
Okay, thank you very much.
Okay. Okay, finish. Just information for you. You can do manage the one in the home like I do every day until your one really dry.
Yes, I understand.
Okay. And then you must control yourself and your food healthier, like eat like meat and fish, vegetable, fruit, and milk to fast healing one.
Okay, thanks for your information.
Okay, I will go into the room because you need some help. You can press the bell in your set bed.
Okay, thank you, nurse. See you.
See you.
Dua, satu.
I'm breathing air in, the air is such a troubled cloud. Mucus is broad with motions, it's broad in motion, the train the air goes down. Yeah, taking any reason to, but remember this too, and you know we do. Yeah, from oxygen to, and then breathing narrow to, bronchioles. Let's go, respiratory system is meant for your lungs, and messages that lead the oxygen to blood. It's right around your body, organs, everyone. Breathe out gas, carbon, and these are the lungs. That's right, it's the lungs. Respiratory system. As bronchioles and cluster, and gas and cluster, capillary unit blows. Oxygen travel slowly to capillaries, internal respiration down. Get out carbon dioxide removed, body breathing out for you, medicine right. Let's go, respiratory system is made on your lungs, and messages that lead the oxygen to blood. Oxygen everyone, without gas, carbon, and these are the lungs. The respiratory system. Respiratory system.
Assalamualaikum, Miss.
Waalaikumsalam, Mas.
How are you, Miss?
I'm not back to thanks.
Okay, Miss. Could you state your name and our old Miss?
I'm Rahma, 20 year old. Where are you asking me this?
I supposed to know you are what I think you are.
Oh, it's good.
Okay, let me introduce myself. My name is Novi. I'm nurse in here.
Hello, Novi. Nice to meet you.
Hello, Miss. Nice to meet you too. I will ask you some question about our sick story and maybe taking some notes. Is that okay?
Yeah, sure.
Okay, Miss. What are our complaint, Miss?
I have urine frequency for about 48 years.
Okay, Miss. And then?
It feels so hard when I do.
Okay, and did you see the blood on your urine?
I think I have in a blood in urine, but not sure. Is this blood or something?
Okay, Miss. Have you ever suffered UTI before?
I never suffered UTI before, Mas.
Okay, and do you have some back pain?
No, Miss.
And then, how about the flank pain, Miss?
No, I flank pain too.
Okay, and did your vaginal cut irritation?
No, I don't vaginal irritation.
Okay, and did you consume any medication?
Yes, I take an oral contraceptive pill like Monovaci.
Okay, Miss. I have been taking some note about your history, and then I will be check your vital sign.
Yeah, sure.
Okay. Now I will check your pulse and respiratory rate and your temperature. Okay, Miss? Okay. Okay, Miss. And then your blood pressure 120/80, and then pulse 98 times a minute, and the respiratory rate 20 times a minute, and then temperature 37 degrees Celsius.
Isn't it okay?
Okay, I think you must take urine analysis to know what is your illness.
How does urine?
It took urinary to detect what is your disease.
Okay, Miss, I will do checking.
Okay, Miss, don't forget drink a lot of water.
Thank you, Ras.
You're welcome, Miss. And then I will go, and then if you need me, you can call me in the nurse stations.
Okay, Ras.
Okay, Miss. Assalamualaikum.
Waalaikumsalam.
Hello, Mr. Nanda. I I am Rina. I am nurse here. I will give treatment for you.
Yes, I'm glad to hear that.
Could you tell me about your problem, please?
Yes, I have a persistent cough and pain.
What have you done?
Previously, I have been consulted in the clinical, but the doctor asked to be referred to the regional hospital on the ground of the laboratory equipment are more complete.
Is there family member have?
Yes, my brother had a history of tuberculosis, sign and symptoms same with me.
Any possible to you because it can same with you? And where do you work?
Paper factory.
Are you smoker?
Yes, I am.
How much?
One pack with.
Not too much, but can be dangerous your condition, right?
Yes, I know.
How long have you been smoker?
It has been 5 last year.
Have for quite a long time, yeah?
Yes, right.
Okay, last question. What about your food?
I often eat greasy food.
Okay, Mr. Nanda, do you know tuberculosis?
Yes, it's infection disease. I'm here from my brother doctor.
Okay. Do you know how contagious of the disease for tuberculosis?
Yes, I know. Yes, I know the spread disease through and the air and contact directly with the patient.
Alright. I will give you medicine, but previously I will take your specimen sputum to certainly what about the disease.
Yes, nurse.
Okay, if you cough, throw the sputum in the bottle. Do you understand?
Yes, I do.
Okay. I will check in the laboratory and explain the doctor and want to ask medicine receipt.
Yes, nurse, thank you.
Okay, Mr. Nanda, thank you. You must wait in here and I will meet you after that.
Yes.
Assalamualaikum. Mrs. Putri, my name Nurul. I'm nurse. I hear from the nursing. You have cold and asthma, right?
That's right.
I will take your vital sign. Are you ready?
Yes, nurse, I'm ready.
check your barcode. And the pulse. And the respiration. Mrs. Putri, I will assess my result and then I will give you about a nebulizer therapy. Give a nebulizer to minimize cold and asthma. Are you ready?
Yes, nurse, I'm ready.
The nebulizer contain Ventolin and ACL. I will use this and you must breathe with your mouth. Do you understand?
Yes, nurse, I understand.
I will use this nebulizer into your mouth and your hair to breathe using for your mouth for 15 minutes. Have you must for your mouth. Okay. Now. How are you feeling, Miss Putri?
Much better, nurse.
That's right.
If I may consume food such as eggs, milk, beans, and fish,
Maybe, but if you don't are allergic to this food.
well, I had heard that asthma sufferers shall not eat salt. Whether nurse?
Right. If you consume too much to salt, can danger asthma relapse.
Okay, thanks dear for information, nurse.
You are welcome. Any question again?
No, nurse.
Okay. In your assessment result, the blood pressure is 120/80, and respiration is 54, and temperature is 37, and the last pulse is 94.
Okay, thank you, nurse.
Okay, I will back in the wrong nurse station, and you can call me. Please with your sheet.
Okay.
Assalamualaikum.
And what is circulatory? The head is oxygen, never gets there on goes into for passing spirit, that is will not away. The clock is moving in, growing. Some smell upper part two, and they will come again until the flowers. Circulatory, that is no upright. Seven levels, flowing in plasma. Circulatory. There's a lot of more. Circulatory. And it is in war. Group A and B together. Circulatory. weekend. This man or friends, September 10th, floating in plasma, circulatory, invisible, when at Paris, capillaries one, circulatory, group ionic, happy together, circulatory, press the transfer and please number from the expression. Just press to the left side, go back to body, and use those long hands, get you out again.
Okay, Assalamualaikum, Ma'am.
Waalaikumsalam, Mas. Can you take me to the room, children?
What about the state of the child?
My son still after his fever, nurse, but especially afternoon and evening had 7 days ago.
In addition to the head weather other complaints, Ma'am?
Yes, nurse. My son still weakness, disease, and nose.
Okay.
Okay.
Okay, whether the child has a history of disease like this, on the child or other illness?
Yes.
Okay. Okay, Mom. I note and the result examination of vital signs of your child. Blood pressure is 110 over 70 millimeter high grams. Pulse 98 times over minutes. Respiration rate 24 minutes over and the temperature all high is normal but 39 derajat Celsius.
Yes, nurse, but very hot in it.
Yes, Mom. Now I will take the blood the child on to do laboratory tests to determine of your child illness.
Then the reason will the without awareness.
Wait.
Then the reason with art awareness.
Yes, ma'am. Because it can. Okay. Based on my assessment and an interview with her mother yesterday, and the one result laboratory maternal. Your child the illness.
Okay. See you, nurse.
Okay, see you.
Yes.
Assalamualaikum.
Waalaikumsalam.
I am Eko. I want to check my disease.
Okay, Mr. Eko, would you please your state, birth date, and your name?
My name is Noriko Setiawan, February 28, 1996, from London.
Oh, okay. I am Ismi, I'm nurse here, and I will asking about your history, maybe taking a note. What do you bring to the hospital today?
I feel my feet boom, cramp, and painful to walk 15 until 100 meters.
Do you have ever experienced tempting?
No. I'm three concerned in the hospital.
Have you got treatment?
Yes, I have laboratorium test and I go to dermatologist.
Are you on any medication?
Yes, I seldom consume medication.
You told me you have laboratory result. And do you bring the result?
Yes, I have.
Can I see it?
Yes, you can.
Oh, the laboratory result is glucose urine is positive and the urea is 88 milligrams over DL.
Yes. I don't know.
And then this is normal urea is 15 until 40 milligrams over DL, and your glucose urine is positive. This is sign of diabetic.
What is the diabetic?
Diabetic is chronic disease when the pancreas don't produce of insulin, or when the body cannot effectively to use of insulin. The diabetic characterized by exceptional glucose urine is urine frequency.
What the effect on the brain?
The dry can skin, and then the blood sugar is high. When the blood sugar is high, our body try to eliminate by excess blood sugar blood in our body, and this is increase urine waste. This is condition causes to dry. If the skin dry, fault skin, you will feel a sore, headache, and right, and don't take regular medication.
I don't know. When too dangerous?
Mr. Eko, the blood pressure level is determined to glucose level, and then this can shit in this our body, and then this is so dangerous for our body. And then I will check your blood sugar height.
Yes, I can.
Let's do that. Please. Could you hold out your finger, please?
It's hurt.
No. And then I will check your blood pressure and your pulse. Can you raise your sleeve, please? And I will check your pulse. Mr. Eko, and then I will check your ground. This is seen black, and then see inflammation. Mr. Eko, this is your result. Is glucose in the urine is positive, and then your ground is inflammation and black, and your blood pressure 120 milligrams over dl. Your pulse is 84 over minutes, and blood sugar height is 210 milligrams and over dl. Mr. Eko, I will inject insulin.
Yeah.
Mr. Eko, if you low to the blood sugar level, you must reduce your drink, your sweet drink and your food, and you must replace rice with potatoes or with another carbohydrate. And to your ground, I will give you some ointment and some tablet, and then you must exercise every day.
Thanks, nurse.
Okay, you are welcome, Mr. Eko, and I hope you remember my instruction.
Always, nurse.
Thank you, Mr.
Thank you.
Assalamualaikum.
Waalaikumsalam.
Good morning, Mrs. Devi. My name is Nana. I'm a nurse. I would like to check your personal data.
Yes, of course.
Okay. I'll just like to your name and your date of birth. Are you sure?
Sure.
What's your name?
My name is Devi, Ratna Devi Puspita.
Okay.
My date of birth is the 5th of June 1996.
Okay, so your age is 20 years old. And do you have a husband?
No, I am single.
What's your job and do you have health insurance?
I am a student and yes, I have.
Do you have a doctor refill?
No, I do not.
By the way, do you have a family with history of asthma?
Yes, grandmother have an asthma.
Okay, your grandmother. So I want to check your vital sign, okay?
Yeah.
This is in here. Okay. Okay, Mrs. Devi, by the way, what do you feel now?
I feel very low.
What this notice it?
I was fever and shortness. Sometimes I was coughing.
Okay. What do you feel if you breathe?
I feel in my lung.
That I give you scale 1 until 10. How do you scale of your pain?
I feel pain in my lung in 5.
Oh, the scale is 5. Okay. I finished to check your temperature and vital sign. Your blood pressure is 110 millimeter Hg and your respiration rate is 30 times a minute and your heart rate is 80 times a minute and your temperature is 37.5 Celsius.
Okay.
And then I want to check your head, face, and your neck. Okay.
Yeah.
Excuse me, I want to check your head. Your hair is black and not less in your head. And then next, I want to check your eyes. Can you close your eyes? Okay. Can you open? Okay.
Yeah.
Thank you. Your color in your eyes is black, and then your conjunctiva not anemis. And
Okay.
next, I want to check your nose. Your nose. Your nose is many secret in nose, but not have a polyp. And then you can breathe. I want to palpation in around your nose. That you feel pain, you can tell me, okay?
Okay.
First, I want to check your sinus nasal and then sinus lacrimal. And last is sinus frontal. Do you not feel pain?
Not I do.
Okay, that's good. And you can breathe. I want to hear your sound of the lung. Can you breathe in with your nose and breathe out with your mouth? Again. I hear the bronchi sound in part of your right lung. So this is maybe a secret in right one.
So what can I do?
Don't worry, your doctor can give you prescription for it. So can you smile? Okay, thank you. Open your mouth. I want to check your teeth. How many you brush your teeth a day?
Two times, nurse.
Okay, that's good. And then I think enough. So I finish to check your vital sign, your head, your face, and your neck, and then I will come back to put your medicine. Okay?
Yes,
you
thank
can
you,
wait
nurse.
me. Okay. Hello, Mrs. Pupita. This is your medicine for your doctor, and your doctor give you antibiotic.
Yes.
And then this is the bronchodilatory for your cough.
Yeah.
Okay. I will to put your blood sample to I borrow in laboratory. Okay.
Yeah.
Okay. Okay, now. I will to borrow your blood sample in laboratory, and this is assessment is enough. I will to come back in my room. So thank you, Mrs. Devi, and assalamualaikum.
Waalaikumsalam. Thank you, nurse.
Yes.
Identical. Determine how your life kind of color of the next choices. You know the chromosomes that's up here. This is the saddest from the group. All the things on the person to me to get over the guys. Yeah, it's getting tricky. Yeah, marry to get the seas. Yeah, the devil had expected. Yeah, I didn't just mistake to me, and the room for a sweet symphony, mastered by cause and no. Send the cut of the cycle blast the genetic messengers. RNA, DNA, differ in many ways, yeah. To me, messenger and is the DNA in ya. Is the in ya. In ya. In ya. Every night was sweet to me. I shouldn't mind to how much is my love DNA? So separate. Oh, I do
afternoon, Amalia.
Good afternoon, nurse.
How are you feeling now?
Oh, not too good. Everything hurt.
I can imagine. You've got a lot of cuts and bruises. Can you tell me where the pain is?
Yeah, my head, my cheek, the broken cheek. I mean my hurt when the cuts are, and my chest hurt too.
Okay. Can you tell me if the pain is same all over or different?
Yeah, I've got a throbbing headache and my right cheek when I touch it.
That'll be because you've got a broken cheekbone. The pain is referred through your head and you get a headache.
Oh, okay, that makes sense.
What about the pain in your arms and chest, Maria?
It's a stinging pain in the shallow cuts, but the scar in my chest is quite deep, and the pain like a knife.
And when the pain works, Amalia?
It's worse when I turn over or move.
Okay, can you rate the pain for me on a scale from 0 to 10? 0 is when you feel no pain, and 10 is when you feel the worst pain that you can imagine. What about the pain like now you are at rest?
It's around 6.
And when you move a bit?
It gets worse, 7 hours.
Okay, I'll get something for the pain for you. Now I notice the paracetamol for our room.
Yeah, I don't want it. It ain't strong enough.
No, not it's on. But they ordered it for you because it works with opioid painkillers to reduce the amount you need to take.
Huh?
I mean, it's reduce the number of the injection you have to take by 20 to 30%. It's important to keep the paracetamol regularly.
Oh, I see. That's different then.
Okay, is there anything else which relieves the pain?
One of the nurses gave me a heat pack and my chest and have that.
Okay, I'll get the painkillers for you and put you in a comfortable position with some more clothes. I'll get the heat pack too. Excuse me. For your chest. You feel warm?
Thanks. I'll try to get some rest. It's hard to sleep while you're in pain.
Okay, I know. I'll pull curtain around and dim the light a bit for you as well.
Thank you.
Go. Thank you. Assalamualaikum.
Assalamualaikum.
Waalaikumsalam.
Excuse me, I'm Nurse Rainata. I'm in this hospital. I will give you an advice. It's right with Miss Rahmatika, 22 years old.
Yes, nurse.
Okay, how are you today?
Not bad.
What you're complaining?
A week ago, yes, I feel hurt my leg and I wear replacing bandage, but the wound is not healed.
Okay, I will replace your bandage and look at your wound.
Okay, nurse. Take one.
Okay, excuse me.
Yes.
Look, septic flow out from your leg.
Yes. Is that okay?
First, I will take it off and look your wound. Just wait. It looks like you never change your bandage.
What worse?
No spin CPAC, but your won't get infection and any pus.
It looks scary to me, nurse.
Don't scary. I will change your bandage and take care with your wound, so you can tell me about your medical history.
Okay. I have a history of edema associated with chronic renal insufficiency and cellulitis.
Yes.
Nurse, what is chronic renal insufficiency?
Chronic renal insufficiency is a medical condition characterized because pain and swelling at the leg due to damage at the vein valves. The blood accumulates in the vein.
And I also a history of hyperpigmentation and deposition nemosideria on left foot.
Okay, can you tell me about your advice from your doctor before?
He said to me to wear compressed socks and control edema always, but I not wear it.
Okay, I see now. You're injured because you didn't wear your sock compression, right?
Yeah. Caused it?
Okay, wait, just wait. I will tell you. Okay, it's done. So if you want to hearing face, you should replace your bandage after you take bath and keep it away from the weather. So I will ask your doctor to receive to you a bandage with waterproof.
Okay. So do you have advice to me?
Okay, my advice to you is you should consume a food with high protein like fish, meat, egg, milk. It's good to your wound to heal fast.
Okay, nurse, thanks a lot.
Yes, okay, it's done and I will be back so you can rest and get well soon.
Thank you very much, nurse.
Yes, Assalamualaikum.
Waalaikumsalam.
Oxygen, moving air from the lungs, turn to ventricle it pumps, out the sense of blood. Just relax, feeling of blood is in your heart. Atria contract, feel the ventricles contract too. Oxygen your body needs, the heart beating. contract. Feel the ventricles contract too.